You're watching TV 23, your local connection.
We're going to be talking about snoring, and joining us for this conversation is Dr. Joe Corcus, who is an ear, nose, and throat surgeon, and we're going to be talking about a new laser therapy for correcting snoring. First of all, Dr. Corcus, maybe you could explain to us what causes snoring.
Actually, snoring is quite a common problem, and statistically there is 1 out of 4 habitual snorers around. And by the
So
age
1 out of every 4 people is a snorer?
habitual snorer.
Okay.
And by the age of 60, 60% of men and 40% of women are snorers. So you can tell how common this problem is. The commonest cause of snoring is that there is redundant tissue in the soft palate and the uvula that tends to vibrate and cause snoring. And this happens when you inhale, creating air turbulence behind this redundant tissue that leads to oscillation and vibration of mainly those 2 structures, leading to snoring. And initially it's not taken very seriously, but as time goes by, the spouse becomes very irritated, and then she or he will tell his or her husband, you know, that there's such a problem. And if this is not corrected, then they start to sleep in a different room or different floors, and then where the problem starts.
Okay, let's talk to Tony for a second. Tony, what happened to you? Who told you?
Well, it was my wife.
It was your wife?
Yeah,
Did you believe her?
Not at first. I was kind of skeptical. I denied what was happening at first. I thought, no, I don't snore. I was getting a good night's sleep. So I thought she was complaining.
So what about you?
Well, I've known for 20 years that I've had, I've been a snorer, but I've been ribbed and chided and so on. It really hasn't bothered me. And I know on some occasions, if I was physically tired or if I've been drinking, my snoring was terrible. And my wife would poke me in the ribs and I'd roll over, sleep at my side, and I thought, I would quit snoring. But a year ago, we shared a cottage with 3 other couples, and in some situations what I would do is intentionally keep awake until everyone went to sleep to give them a chance, and then I would fall asleep. Well, this particular night I heard another individual snoring, and I thought, this person, it's excessive, it's very loud. And I eventually went to sleep. I woke up the next morning, and the people were complaining about, the 2 chainsaws in the cottage. We were all in 4 separate bedrooms, and I realized at that time that my snoring, it was excessive. And as well, I was beginning to have very, very restless nights, and something was causing it. And I went to my family doctor, and he recommended that I see Dr. Corcus, did an examination, and recommended the surgery.
For you, Tony, your treatment is completed.
Yeah, I've been very lucky. It was very effective. I had the 1 treatment, expecting to have to go back maybe 3 times, 4, maybe as many as 5 times. But after the 2nd treatment, my snoring stopped completely. So, yeah, I'm really glad I went into the experimental program, if you like.
How glad is your wife?
Well, she can't sleep now because I'm too quiet.
Oh no.
Are you awake?
And you're about, what, about 75% through, 80%?
According to my wife, she claims that it's been a 75% cure, so I'm looking forward to another treatment.
So you have, what, probably 1 more treatment left?
I hope, but...
Hopefully.
Advantages being known? The advantages to the
of the laser?
Yeah.
It's an outpatient or an office procedure, local anesthesia, no general anesthesia. It's a simple, safe, bloodless, painless procedure, and all it entails that the patient will have to come. That will be the disadvantage in a number of sessions versus 1 session procedure with the traditional treatment.
Tony, worst part, best part?
Well, after the first treatment, I'm probably 3 days into the recovery. I thought, why the heck have I subjected myself to this? I thought, given my time again, I just wouldn't do it. But a week later, I was saying, gee, this is great. I got to go back after the next treatment and see what happens. And of course, after the 2nd treatment, I knew what to expect in terms of recovery, so it wasn't quite so bad. And of course, after the second treatment, recovery period, maybe a week or so, I thought this is great. You know, why did I delay all these years and have all this trauma at home when there's a procedure relatively simple that can cure it? And I am not snoring at all.
Well, thank you both for coming on today and talking about this new procedure, because I'm sure there's a lot of people that are interested in knowing about this. And Tony, I'm glad to see you're back together with your wife again. Things are working out there. We'll see you tomorrow. Bye-bye.